Hey, this is Dr. Ty from Premier Orthodontics, and in this video I'm going to show you how we fix deep bites in our office. I'm going to show you a before and after of an actual patient who received treatment at our office. We'll talk you through the mechanics, the treatment planning process, hopefully try to demystify the process as well. So let's get started. Alright, so we're going to go ahead and jump in here. So this patient, you can see she has quite a deep bite. So she came in, she felt like when she smiled, her teeth didn't show. You can see in the photo here, when she smiles, she has very little tooth showing. She has mostly just her gums showing. And that is due to the top teeth being overgrown. And you can see they're growing down over top of the bottom teeth. So you can see her teeth were relatively straight. They weren't too bad. But she definitely didn't like her deep bite, and she also didn't like how narrow the width of her smile was. So this was something that we definitely told her we could improve upon, and we decided to go with braces and treat her case. So one thing I get asked quite a bit is, why are deep bites a problem? So like we said, this patient had relatively straight teeth. So this video helps demonstrate why functionally deep bites are not ideal. So when your top teeth overlap the bottom ones, over time, those teeth take a lot of wear and tear. So if you're young, you may not notice any wear and tear because it's still early on. But as years progress, you get into your 20s, 30s, or 40s, over time, these teeth do just tend to wear down. And if a 50-year-old comes in with a deep bite, they tend to have very little tooth left. At that point, you're left with decisions of, do I need cosmetic dentistry? Do I need to get veneers or crowns? So if we can fix this early before that damage occurs, that's much better. So like I said, aesthetically, it looks better to fix, to have the bite not deep, but functionally, it is much better to not have that deep bite as well. So we'll go ahead and jump in here and talk about the treatment planning process. So the treatment options for deep bites are braces with bite turbos or bite pads. We'll show you what those look like. These are usually done in a combination with elastics or rubber bands. And in certain cases, an appliance called Forsus Springs are helpful as well to help with deep bite correction. So bite pads are little, the ones we use in our office are blue, but they're little balls of basically resin or composite placed on the teeth. So we often place them right here on the first premolar. Sometimes they're placed on the back molars. And so these help to keep the back teeth from touching. And so if you can see this patient here, if we were to put braces on her, she would actually bite right on top of the brackets and break them off. And so this is necessary just from a functional point of, we need to have separation from the teeth and the brackets so that they aren't broken off. But also, when these back teeth are separated, over time they tend to drift together, which will help to keep that bite open and to open the bite. So rubber bands help to expedite this process. You can see if you have a bite pad in place and then you have elastics on these teeth behind the bite pad, they tend to get pulled together, and that keeps these front teeth separated. So you can see as you open and close throughout the day, these tend to pull these teeth together and to help to increase that deep bite correction. So bite turbos are very similar to bite pads, but they are done on the front teeth. So these are done in more of extreme deep bite situations. In this video, we'll show you how that works and demonstrate how that helps to correct a deep bite. So the bite turbos we use in our office are generally clear. They can be metal in some cases, but they're placed behind the front teeth, and then functionally the process is the same. It keeps the back teeth separated, and we would usually add in rubber bands with this situation as well to help hold those teeth together. And as your teeth bite in the front, the back teeth slowly drift together as those front teeth are held apart. Helps to treat the deep bite. So some patients ask, how do I bite or chew with these bite turbos? It is not easy at first. It is really awkward. But after a couple weeks, you start getting some contact on the back teeth again, and you're able to chew a little bit more normally. So over time, it gets better. First week or two, it is a little bit difficult. You have to eat softer foods that doesn't require a lot of chewing, and most patients get through it with a little discomfort. All right, so going back to our patient here, we started her off with a combination of bite pads on the bicuspids, elastics, and braces. We also decided to do some Forsus Springs on her as well. So we'll show you what this appliance looks like here. So the Forsus Springs help to push the bottom teeth forward and top teeth back. So patients have a combination of a deep bite as well as an overbite. These will help because it helps to push the bottom teeth forward and down, which will help to correct the overbite as well as the deep bite. So not all deep bite patients will need these, but this patient, we use this appliance as well for about 4 to 6 months. They stayed in the mouth. They are usually started after about a year of braces. Then these stay in for about 3 or 4 months or until the bite's corrected. And so again, here is our patient with that deep bite. She went through about a year of braces. We put on bite pads. We had her wear rubber bands during that first year. After that year, we switched to the Forsus Springs. She kept those in for about 4 months, I believe. And total treatment time was a little bit under 2 years for her. So you can see by the time we were done, now with her smile, she shows much more teeth. We were able to successfully intrude these front teeth so that more of her front teeth were showing when she smiled, not so much gums. We helped to expand her smile so it kind of filled out her mouth more. She was very happy with her smile. And like I mentioned before, her teeth weren't that crooked prior, but the deep bite was definitely helped. Before she was biting all the way down on top of her gums. And now you can see she's biting with several millimeters of her tooth showing. So here are her before and afters. You can see smiling. Before she had a lot of gum showing, very little tooth showing, and kind of that narrow smile. Now she's got much more teeth showing and a much broader smile. And you can see how much deep bite correction, where before you couldn't see her front teeth at all. Now you can see all the teeth, and this is what we consider an ideal bite, where the top teeth overlap the bottom teeth by about 2 millimeters. A lot of people ask what we consider an ideal bite. This is right about where we want. It's about 2 millimeters. You can see the Forsus Springs help to push the bottom teeth forward so that we got the overbite corrected as well. And then looking at the top and bottom teeth, like I mentioned, there wasn't a lot of straightening to do. We did broaden out and widen both the top and lower arches to help give her more of that cosmetic smile. So that's about it. This is one way of fixing deep bites. There are lots of different ways to do it. Different doctors will have different methods. These are the ways we prefer. And if you have any questions about deep bite correction, feel free to ask them in the comments section below. If you found this video helpful, please give it a like. Also, if you're new to the channel, make sure to subscribe for more braces related content. Make sure to tap that bell to get notifications. Thank you so much for watching. We'll talk to you soon.